Kidney stones are made of the actual compounds that are dissolved in your urine. All these different things that are filtered out of your blood and into your urine, when they're at high concentrations and the environment is just right, they can crystallize or precipitate into the solid state. And then they'll grow and grow until they actually form into rocks. And if you were to think of your kidney very broadly, it's made up of two parts. There's the solid part, the outer part, that actually does all the functioning that we know about a kidney with all the blood. And then if you were to slice it down the middle, you'd actually see that it's a hollow plumbing system. So stones actually form within the plumbing system. And once they're rocks, with rare exceptions, you can't do anything to dissolve them. They can either grow further, they can pass, or you can have a treatment to remove them. I think the biggest misconception about kidney stones is where the pain comes from when you're passing a kidney stone. And a lot of people think that the stone passing through and scratching is what causes a lot of the pain. And while it is irritating and causes swelling and inflammation, most of the pain is actually from the blockage of flow of urine, in that the kidney stone leaves the kidney and travels down its natural plumbing, and the urine can't get by it, and therefore it's the backup of pressure behind the stone that leads to that severe pain that can often bring you to your knees. So the classic signs of a kidney stone are pain. Typically pain associated with the flank or underneath your ribs on your side. You can have urinary discomfort. That may be blood in the urine. It may be feeling like you have to go to the bathroom more frequently or burning with urination. There are also some less common presentations, which are just mainly in the form of an infection. So a fever, and perhaps in patients who are older, they may tend to present more atypically with a bit of what we call an altered mental status. They may seem a little bit delirious or confused, and that can speak to a very serious kidney situation where there's actually an infection growing in the setting of a blocking stone. The severity of the pain can also vary. It's not uncommon that as someone is passing a stone, they will have periods of feeling totally fine and then come in waves of having severe pain that could potentially bring them to the emergency room. So when someone is actively passing a stone, I will remind them that these pain attacks can come and go and they're a little bit unpredictable. And that's where often having communication with your doctor is very important. Of course, if you're just having too much pain that even medications can't tolerate it, that tells us that you're probably not a good candidate to continue watching it and we should do an intervention sooner. But assuming the pain can be tolerated, that someone will give a good chance to try and pass the stone, presuming there's nothing medically wrong like kidney dysfunction or infection. We know that things run in families, but it's a little hard to parse out how much of that is hereditary from actual genes and how much of that is because of dietary habits. In general, about 1 in 10 people will have a kidney stone in their life, and a lot of times that can be associated with their diet. That doesn't mean the diet is the absolute cause, but it is definitely the modifiable thing that will increase their risk. So the classic things you want to do if you're a stone former is focus on fluid, because it doesn't matter what your stone is made out of. The more dilute your urine is, the more those little constituents dissolved in your urine stay dissolved and are less likely to crystallize into stones. Typically, we're aiming for about 2.5 to 3 liters in per day in order to be making about 2 to 2.5 liters of urine every day. A good way of monitoring are you peeing enough is to look at the color of the urine. And typically, it should be a pale yellow. Anything darker than that means you have some degree of dehydration and you should focus on drinking more. Salt is probably one of the other main culprits that we see for increasing the risk of kidney stones. Salt creeps into all of our diets. The recommended daily allowance is about 2,400 milligrams, which is 1 teaspoon. Why that matters in kidney stone formation is that excessive salt in your diet is cleared from your body by your kidneys. And as a result, calcium comes for the ride. So better said, high salt intake will lead to higher amounts of calcium in your urine, and most stones are made out of calcium, so therefore you're increasing the risk to form calcium stones. There may come a certain point that a patient wants to actually treat and remove whatever stones are in there. And that may be driven by the size and number of stones. It may just be driven by prior experiences that they've had with passing a stone and being terrible. It may also have to do with their lifestyle and occupation. If they're frequent travelers and not often near higher level care, they may just not want to be walking around with those little ticking time bombs in them. By far the most common treatment we do, not just in the US, but probably globally, is called a ureteroscopy. Think about a colonoscopy, but for your urinary system. So this is an endoscopic procedure done under anesthesia, where we thread a really tiny camera, I'm talking 2 to 3 millimeters, into the urinary system to wherever the stone or stones are. We can break the stones up into smaller pieces using a laser. And then we have an option to either remove those pieces or just shave the stone down into dust, and then we come out. If you go back just a few decades, it was very difficult to treat stones up in the kidney. In the time where my mentors were training, they used to have to cut people open to remove obstructing stones. Now, with the advancements in scopes and digital cameras, we can treat everything endoscopically and minimally invasively. It's pretty rare we need to do even a laparoscopic, no less than open surgery to treat even the largest of stones. Everything is done endoscopically for the most part. The natural remedies market for kidney stones is gigantic, and it's also largely unregulated. So I have a lot of patients that come to me, something they read online that they can do to help pass their kidney stones or dissolve their kidney stones. Unfortunately, a lot of those things are not rooted in any truth. The things that are actually true are things like citrus, lemon, lime added to your drinks. Those things can certainly help to lower the risk of stone growth. But there really is nothing out there that, one, can force a stone that's already in your kidney to try and pass, and two, there's nothing you can take, with rare exceptions, that can dissolve a kidney stone. There are some special cases, patients who have a very uncommon type of kidney stone, where we can dissolve it, though typically that requires a medication or a supplement that we prescribe at doses high enough to do so. So there's very little out there that I've encountered that is outright dangerous, but I would say the majority of it is just not helpful. So ultimately, nothing beats seeing a medical professional about your kidney stones.